This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Darryn Richard Potosky, MD, a board-certified gastroenterologist and hepatologist, to discuss innovations to help both physicians and patients fight the silent epidemic of fatty liver disease. Dr. Potosky, thanks for joining us here today on eHealth Radio.
Thanks for having me.
You're more than welcome, and thanks so much for your time. So tell us, for starters, what is the prevalence of fatty liver disease and who should be monitored on this?
So it's actually estimated in the United States that as many as 80 million to 100 million Americans suffer from fatty liver disease. So that's a number that is on par, but slightly less than the number of patients or people in the country that suffer from high blood pressure, just to give a background idea of the amount of people we're talking about. As much as 20% of that 100 million, so 20 million Americans, already have damage to the liver from fat accumulation in the liver in the form of what we call fibrosis or scar tissue. And it's actually estimated that as many as 4 million Americans currently have cirrhosis of the liver, which is an end-stage amount of scar tissue in the liver caused by fatty liver disease. So it's a highly prevalent condition and common in the United States, even in the world. It's common in patients who are overweight, have problems, medical problems like high blood pressure, diabetes, high cholesterol, coronary artery disease, and sleep apnea. And it's also been associated in women with a condition called polycystic ovary syndrome. So all Americans with any or all of these risk factors should be evaluated. In just the overweight population, it's believed that 80 to 90% of patients who are considered obese will have fatty liver disease, and as much as 50 to 70% of patients with diabetes will have fatty liver disease.
Well, obviously, we appreciate those details, and I'm sure you've gotten the attention of some of the listeners already. Now, fatty liver disease is often referred to as a silent killer, as we mentioned. What can patients do if they are potentially at risk without even realizing it?
Yeah, so we call this a silent killer because most people who have this condition will not have any symptoms of it. Generally, in the beginning stages, even as the disease progresses, people feel fine. They have no noticeable symptoms related to it. And so patients who fall into any of those categories that I mentioned, with high blood pressure, diabetes, being overweight, high cholesterol, heart disease, should really talk to their primary care providers about screening them for fatty liver disease. And if they're concerned, the things that people can start doing right away without even consulting a physician are cutting down, if not eliminating alcohol use, working on reducing their weight, and then making sure that these other conditions that they suffer from, like high blood pressure, is being optimally controlled, if medications are needed.
Dr. Potosky, I'd be curious, what innovations or lifestyle changes do you see helping to reverse the liver disease epidemic?
So when we're specifically talking about fatty liver disease, the most effective treatment is lifestyle modifications that result in weight loss. So typically this involves working on our food intake and the types of things we're eating to reduce weight, as well as increasing the amount of exercise we do in a day. And we know that even small amounts of weight loss will result in improvement in this condition. And the most important thing to recognize is that it's a completely reversible condition. So when patients lose adequate amounts of weight, which can be as small as 10% of their current body weight, they can completely reverse the disease. We use lots of tools to help patients with this, and some of the best innovations that have come around recently are non-invasive tests that help us understand the extent of patients' liver disease. Some of that is with blood work, so routine lab testing that people get done for their other medical conditions anyway. And we also have access to a ultrasound-based device, which is a painless and quick examination that's able to quantify the amount of fat in the liver and also the amount of damage that may have been done to the liver without doing invasive things like liver biopsy. So we use some of these technologies to follow patients over time to kind of see how they're doing, whether the disease is progressing or in fact getting better as a result of some of the interventions.
Do appreciate the insight and information shared already on this topic today. We're speaking with Dr. Darryn Richard Potosky, a board-certified gastroenterologist and hepatologist, to discuss innovations to help both physicians and patients fight the silent epidemic of fatty liver disease. And he's joined us here today on eHealth Radio's Health News and Technology channels, a part of the eHealth Radio Network. Now, continuing on, what is the importance of routine monitoring for liver diseases, and when and how often should physicians monitor a patient's liver?
Well, as we discussed previously, in certain cases, liver diseases like fatty liver disease can be silent, meaning, people don't feel anything. So monitoring for this is important because there may not be any symptoms that prompt patients to go see their doctor. Liver tests on average should be checked in patients, once or twice a year in general. If a disease is recognized, they can be checked more often to follow the condition. As interventions are made to try to improve things, the lab testing may show us that things are improving. And then we also, like we mentioned before, we use this device called FibroScan to provide information about the health of the liver, the fat content in the liver, and that is something that we follow over time in a patient's disease course. That could be, once or twice a year, depending on the severity of the disease, so we can be sure that we're following it and making interventions as necessary, as patients may not even know this is kind of going on inside their body.
And of course, that scenario is certainly concerning. What can patients do to prevent or reverse liver diseases and keep their livers healthy?
Absolutely. The things that I counsel my patients on with fatty liver disease are avoidance or significant minimization of alcohol use. Alcohol is a very common cause of fatty liver disease and can affect people's livers even in small amounts. Lifestyle modifications, like we mentioned, including improving the diet and increasing the exercise, have been shown to potentially reverse the conditions completely and even help people heal the liver if there is scar tissue in the liver. Patients should work closely with their primary care provider or with their gastroenterologist to help optimally manage the conditions that they have that are associated with fatty liver disease, which we mentioned a little bit earlier. Those are specifically maintaining excellent control of the blood pressure, potentially, with medications, same with their cholesterol, their diabetes, and ensuring that they're managing conditions like sleep apnea. All of those play a role in improving the liver health and can be monitored over time with blood work and the FibroScan device. In a high percentage of people, just doing these things, improving their health, decreasing their weight, minimizing their alcohol, can lead to reversal of the condition completely, as the weight is kind of the central tenet of many of these conditions. The other thing that I educate my patients on frequently is that drastic weight loss is not necessary for this. So even losing small amounts of weight. For some people, it may be 10, 15, 20 pounds over, a course of a year or two will make a significant impact in this. It's not, the type of condition where people have to go out and hire a personal trainer and become a marathon runner. You can do simple things, walking outside, walking up and down the stairs for 10 minutes a day, just changing some things in the diet that are small, and those types of things can make a big impact.
Again, Dr. Potosky, really appreciate your time and all the information and insight shared here today and what you do in this space. And this information certainly is educational and helpful in regards to this silent epidemic of fatty liver disease and the seriousness of all this. If you would, hit that website where listeners can get more information on the technology through EchoSense. I'm sure listeners would appreciate that.
Sure. So there's lots of good information on that can be accessed on the internet. There's the EchoSense website, and that can be searched for and found in many different countries. That tells you more about the device itself. There's also links to information about fatty liver disease, which can also be found online through various websites like the American Liver Foundation. And there's also very good information about these types of conditions on websites like the MayoClinic.org as well.
And certainly some great resources there, and we'll leave a link and or links within the show notes of this broadcast to further aid the audience as well. Dr. Potosky, all the best. Thanks for joining us here today on eHealth Radio.
Thank you so much.
Again, we've been speaking with Dr. Darryn Richard Potosky, an MD and board-certified gastroenterologist and hepatologist, and he joined us today to discuss the innovations to help both physicians and patients fight the silent epidemic of fatty liver disease. And for all the details and the technology of references can be found at EchoSense.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.